Today, we are discussing a topic that has the power to save lives: cervical cancer awareness and prevention. I would like you to think about someone you love. It could be your mother, your sister, your daughter, your wife, your aunt, or your best friend. Imagine how important their health is to you. Now imagine that there is a disease that is largely preventable, yet thousands of women around the world still die from it every year, with access to screening or vaccination they needed. The good news is that we can change that. Education is one of the most powerful tools in preventing disease, and by the end of this video, you will have the knowledge you need to protect yourself and encourage others to do the same. During this presentation, we will answer several important questions. What is cervical cancer? Where is the cervix located? What causes cervical cancer? What is human papillomavirus? What are the warning signs? How can cervical cancer be prevented? What is a pap smear, and why is it important? Who should receive the HPV vaccine? What healthy lifestyle choices reduce the risk? Before we talk about cervical cancer, it is important to understand the part of the body where it develops. The female reproductive system is made up of several organs that work together. These include the ovaries, fallopian tubes, uterus, cervix, and vagina. The ovaries produce eggs and the hormones estrogen and progesterone. Every month during the menstrual cycle, one of the ovaries releases an egg. The egg travels through the fallopian tube toward the uterus. If it is fertilized by sperm, pregnancy can occur. If it is not fertilized, menstruation, or the monthly period, begins. The uterus, also known as the womb, is the organ where a baby grows during pregnancy. Now let us focus on the cervix. The cervix is a small, strong, cylindrical structure located at the lower end of the uterus. It connects the uterus to the vagina and acts like a doorway between the two. Plays many important roles. During menstruation, blood flows through the cervix into the vagina. During pregnancy, the cervix remains tightly closed to help protect the developing baby. During childbirth, it opens to allow the baby to pass through the birth canal. Because the cervix is exposed to infections that can enter through the vagina, it is also vulnerable to certain viruses, including human papillomavirus, or HPV. Understanding where the cervix is located helps us understand how cervical cancer develops and why regular screening is so important. Now that we understand where the cervix is located, let us discuss cervical cancer. Cancer occurs when normal cells change and begin growing uncontrollably. Instead of growing, dividing, and dying in an organized way, cancer cells continue multiplying and may invade nearby tissues or spread to other parts of the body. Cervical cancer begins in the cells that cover the cervix. Fortunately, cervical cancer usually develops very slowly. Before cancer develops, the cells often go through abnormal changes known as precancerous changes or cervical dysplasia. These abnormal cells are not cancer, but if they are not detected and treated, some may gradually develop into cancer over many years. This slow development is one of the reasons cervical cancer is considered one of the most preventable cancers. Health are better than animal cells through regular cervical cancer screening before cancer ever develops. If cancer is detected early, treatment is highly successful. However, when the disease is discovered at a later stage, treatment becomes more difficult and may involve surgery, radiation therapy, chemotherapy, or a combination of treatments. This is why awareness and prevention are so important.